Hi everyone, my name is Lindsay Sayers, and this is my assignment on the elevator speech on the role of the NP. The purpose of this assignment is to prepare future APRNs to communicate their professional role and clarify the differences between APRNs and other advanced practice healthcare providers. What is a nurse practitioner, or NP? NPs are advanced practice registered nurses who have advanced education and training in a clinical specialty where they perform medical acts with a physician supervision. In some states, NPs can act independently. NPs follow the medical nursing learning approach and get licensed under the Board of Nursing. How does an NP differ from a physician assistant, or a PA? NPs and PAs practice in all 50 states and can both prescribe in all states, with just a few limitations varying on the state. Both PAs and NPs provide patient care, preventative care, and health promotion. The major differences between the two professions lies in the area of education, regulation, and the relationship with the physician. NP versus PA education. The training and background is what essentially differs the two professions. For example, PAs follow a medical model as they train. PA programs focus more on the medical aspects of healthcare as they train to become general practitioners. PAs can specialize in anything from primary care to internal medicine to surgical care. In contrast, NPs follow a model that is very specific to an area of the practice of nursing. Unlike PAs, NPs are trained in a specialty area where they have the option to work in subspecialty, which is related to their specialty. I put in this chart here, which kind of just breaks it down on the differences of PA versus NP, which again says that PAs follow the medical model, where NPs follow the nursing model. The education is a little bit different. PAs have to go through undergraduate training with or without clinical hours, and they have to have a bachelor's or master's in PA studies, where NPs usually are a registered nurse first with a bachelor's in nursing, and then they go back for their master's in NP studies. The regulation is a little bit different. PAs are regulated depending on jurisdiction, and nurse practitioners are independent or dependent practitioner within the scope of practice. PA is a non-independent practitioner, and they can practice in all areas of medicine, whereas NPs, it varies on states. For example, they used here Ontario. They can only practice in primary care, medicine, pediatrics, OB, or GYN. The NP versus PA regulation. In all 50 states and U.S. territories, PAs work under a supervising physician. They are required to pass the Physician Assistant National Certification Exam, also known as the PANCE exam, in order to obtain licensure. And on the other hand, in some states, NPs are allowed to work independently from a supervising physician, where the Board of Nursing has the sole authority of making them an NP once they pass the test. However, in other states, the involvement of a supervising physician is necessary for NPs to practice. How does an NP differ from a physician? NPs and doctors are charged with providing quality healthcare that improves patient outcomes. There are some similarities in how they each achieve this. For instance, both NPs and doctors can record patients' medical histories, symptoms, and diagnose health issues. These professionals can also work together to deliver patient care. But there is one vital difference between NPs and physicians. The duties of NPs revolve around providing patient primary care, whereas the duties of physicians encompass complex patient diagnoses, specialty care, and treatments. The NP focuses on patient primary care and can make the patient's best source of information about wellness issues like healthy eating, exercising, and smoking cessation programs. I did put this picture in. I thought this was a good picture. This shows the nurse practitioner versus physician assistant. Physician or doctor. Nurse practitioner, it says that they have 5 to 7 years of experience before practicing. That could be like them practicing as a registered nurse. whereas a doctor has 11 years of experience before practicing. That includes like their residency. They both can prescribe medications. Doctors are responsible for more patients than NPs. They can both diagnose conditions, whereas a doctor is just more of a leadership oriented. They can both order testing and analyze test results, but on the other hand, doctors are currently experiencing a shortage, which could be because more people are leaning towards NPs because of how long it can take to become a physician. Lastly, a physician can refer patients to specialists. I did like this chart. Sorry, it's a little blurry. It does just show the difference of length of education between the three, which is why I believe more people are leaning towards NP and physician assistants. As you can see down the bottom, it does say a minimum of 11 years for total time training. That kind of turns a lot of people away from becoming a physician. And I believe that is it. These are my references that I used. Thank you.